Thank you for joining us. And thank you, Dr. Mridu, for another wonderful session on our healing herbs. Without taking much longer, all yours. Thank you.
Thank you, Dr. Neha. And it's always been a pleasure being here. So today I thought of discussing the drugs or the herbs which we use daily and look at those herbs from the medical point of view. I'm sure everyone must be using spices, probably Indian spices in their food. So we'll be discussing those Indian spices, what are their medicinal use and how can we convert them from being a food to a medicine. That's a basic thing we'll be discussing today. So the first herb which I want to discuss is cumin seeds, that is jeera. I think everyone must be aware of jeera, that what is its benefit and how we can use it. So I'm going to elaborate a bit more. So basically jeera we use in Indian spices to enhance the flavor. And it is always told by our elders that it is very good for digestion. So you should always put jeera, ajwain and all the other herbs to make, good and tasty sabzi or anything we are going to eat. So the cumin seed is a very important Indian spice for the food, and it is widely used almost in all of the India. Everyone uses jeera in some form. So the main medicinal use of jeera, where we use it as a medicine, is to fight for the diabetes. It is very good for the, in the management of epilepsy. If someone is having epilepsy, or if someone is having tumors or any kind of growth in the body, then jeera is of great medicinal use. See, jeera is very rich in iron, and it almost composed to 20% of daily iron dose. So if someone is taking jeera in their food, they are technically taking the iron. So if a female, specifically females who are iron deficient, even males are iron deficient, but female ratio is more. So they can use jeera and in a form like either in the form of decoction or in the form of jeera powder, and that will help them as a iron source. And regarding that, jeera is good for iron, but it is also rich in many more vitamins, which we'll discuss later. But the main thing which jeera is very beneficial for is obesity, cholesterol control, any kind of chronic diseases. Like if someone is having heart disease specifically because of high cholesterol, then jeera is very helpful. It can efficiently reduce the cholesterol levels, and I have seen it myself in some of the patients. They were told to take the jeera decoction along with the medicine. No doubt I had given the medicine, but the results were far more better than the patients who were not taking the decoction. So it's very good for the cholesterol level, for the reduction of cholesterol levels. And it promotes the digestion as in it makes the person hungry. If a person is not feeling hungry, or like sometimes we feel like, no, we don't have any appetite, we are not able to, like if we are hungry, then even the food comes, we're not able to relish it, or we are not actually hungry. So for that purpose, jeera can be taken, and how it will be taken, I'll tell you after that. But first, let's discuss that what it does. It promotes the digestion. It increases the pancreatic juices and all other juices of the body. So technically, it makes us hungry. And it's a mild carminative. Carminative is a kind of laxative, but with antimicrobial and antiviral properties. It has antimicrobial, antibacterial, antiviral properties. It is very good for any kind of food poisoning. It is very good for cough, cold, or any kind of condition which is due to either it is bacterial, viral, whatever it is. Jeera is good for that. It helps in the management of treatment. I'm saying management because it's not a single drug to be used as a treatment. So it helps in the management of piles, hemorrhoids, fistula, fissures, all those problems. These can easily be managed by the use of jeera. And the other basic, as I told you, it aids the weight loss because it's a carminative in nature. It reduces the cholesterol. So it's a complementary feature that it helps in the weight loss, and we use it to number of patients who wants to lose the weight. Its very main and major property is it helps in fighting the cancer, it is known as the chemopreventive drug. There are very few drugs who have been labeled as chemopreventive drugs, and Jeera is one of them. It helps in the benign stages of the cancer. It helps, it prevents any kind of growth in the body. And if somebody is on chemotherapy by any chance, then it is chemoprotective in nature. It helps in the reduction of the side effects of the chemotherapy. So it's very beneficial for that purpose. And it helps in treating the insomnia also. But we can't say that it's a very effective drug in insomnia. It's not like that. But if someone is having mild stress, anxiety, and it's hypnotic in nature, it's basically, if you want a specific anti-stress, then instead of whole jeera, you have to take that essential oil. You have to extract the oil of jeera, and it is available in market also. Cumin oil is available. That is specifically sleep inducing. So we can go for that. And it also helps in asthma and cold, as it is it is antimicrobial property and anti-inflammatory also. So it helps in the proper management of asthma and cold. And it soothes the skin. See, it's basically it's not dry in nature, so it nourishes our skin, and it helps in the treatment of acne, and specifically if there's some kind of allergies, stings or something like that. If it is mixed with some kind of drugs, like I'll tell you how, it can be very beneficial. Like if we mix the jeera with pepper, then it is very good for digestion problem, for food poisoning. Or if we mix this with jeera with some carom seeds, or with some, you can say, the other drugs which are very good in it, like I told you, giloy or something like that, then it is very beneficial for the acidity purpose. Like if for acidity, there's one more thing you can do. You can mix jeera and dhania, and then make a decoction out of it, and then drink it. It is very good. And if someone is having a very strong acidity, then they can also put a pinch of mishri, or crystallized sugar. Then it is very, very good for the acidity also. And if someone is having loose motions or diarrhea, then it can be mixed with dried ginger and soft powder. Then it is also good for the diarrhea. And the basic thing which I tell to my each and every patient is to take, you roast the jeera and store it, and then eat it after the food, like you eat the fennel seeds, like mukhwas, how we take the mukhwas after the food. So instead of that, take the roasted jeera. Your digestion will be all good. There will be less pain in your body. Your body will feel fresh. There will be less stiffness. And the best thing, if someone wants to lose weight, lose the cholesterol or anything like that, then they should take the jeera decoction in the morning. But what we have to do is to look for the jeera quantity. See, like I told you, it's good for diabetes. And if someone is having diabetes, under diabetes medicine, so they should take less amount of jeera as a medicine, not as a spices, I'm telling here, as a medicine, because it will help in lower the sugar levels also. So the sugar will be more lower side. So you have to manage that accordingly if you are a diabetic. But otherwise, you can have 1 teaspoon of jeera, put it in 2 glasses of water, boil it, and then you just reduce it to 1 glass, and then strain it and drink it. That's best for weight loss, for cholesterol, for inflammation, for stiffness, for any kind of heart ailments, for any kind of pain, for any kind of allergies. It's the best thing. And to promote the digestion, you have to roast the jeera. See, if someone is having a lot of gas problem, then I recommend, and is not hypertensive, so I recommend people to use roasted jeera with kala namak. So it's also very good for the digestion purpose. But again, as I told you, everything has some effects and side effects. So the biggest side effects of jeera is it helps in the reduction of testosterone levels in men. That's the biggest side effect. But for female, if the female has testosterone level high, then jeera is the best drug of choice, herb of choice. And secondly, it reduces the sugar level. So if anyone is already on diabetic medicine, then they should not take much of jeera, or should consult their doctor about the medicine and how to take they should fix the dose. And it should not be given to any pregnant women. And because it is, as I told you, it's a mild carminative. So it has, shown in some studies to, start the bleeding. So one should not take jeera decoction or roasted jeera during pregnancy. That is one thing. You can use jeera as a spice, because when we mix it with the oil and all other ingredients, it acts totally different. It's a food, it's not a medicine. But if we use it separately as a medicine, then it acts on the body as a medicine. So all the side effects which I told you is of eating it as a medicine, not as a spice. You can use it as a spice, but still quantity we use a very little of jeera, maximum 1 teaspoon in a whole day, I think. So that's a very adequate dose for using jeera as a spice. So the next spice which I'm gonna discuss today is carom seeds, or what we call ajwain. That's another very important drug and very beneficial herb, which is widely used whenever there's a pain. Everyone says, even in my family, even who are not from Ayurveda side, they say that take ajwain with warm water, your pain will be relieved. So it's carom seed is very beneficial for pain, anti-inflammatory properties, specifically if there is a pain in the abdominal region, or if someone is having any problem with their periods, PCOS, or any kind of, a scanty bleeding is there, then ajwain is very helpful. There's a one combination which I give to each of my patient, that you roast ajwain in ghee, and then you put gur in it, and then you make small balls like pills of that thing, and you take 3 to 4, and it increases the flow of the if someone is having PCOD, irregular periods, or very scanty periods, then one should do this. It is very effective, and all the properties of ajwain are same as jeera, and they're almost if someone is not very much aware, then they also look the same. Jeera seed is bit longer, but ajwain seeds are a bit flat and small. But the its aroma of these two drugs are different. The aroma of ajwain is more like thyme. So it also helps. It's also carminative, antimicrobial property. Ajwain has very good antimicrobial property. Even it is given to the kids who have, the issue of any kinds of worm infestation. Ajwain water is 1 teaspoon of ajwain water is given to the kids here, and it is very good carminative. It is very good for pains. It is very good for reduction of weight and cholesterol. But since ajwain is bit pungent than jeera, so the dose should be very less, and it is warm in nature. Like in jeera, I told you, it's not very warm in nature. It's of subtle nature. It's neither warm nor very cold, so it works. But the ajwain, it's warm in nature, so we should be little cautious of the weather as well as the prakriti of the person before using ajwain for a very long period. And again, it should not be given to the any pregnant or any breastfeeding female, because it will not go well with them. So we better avoid them as a medicine. And again, it can be used as a decoction, or it can also be roasted, or it can be used with the salt, like I told you, in any kind of gaseous issues. So it is very good for that, and it can be taken for the longer period. But the biggest problem is to look out for the weather and everything. And all the jeera and ajwain, these are the two drugs which are very good for cough and cold, but we hardly use them. I have seen, and I have also done myself also. If I ever get a blocked nose, I just boil ajwain in water and then take steam out of it. So it's very good. And one more biggest property of ajwain is it helps in indigestion and peptic ulcers specifically. It has proven to be very good in the management of peptic ulcers. If someone is having any kind of ulcers, they can try ajwain. It's very good. And by that, I mean chewing of ajwain, not the ajwain decoction. You should chew the ajwain. So it's also very beneficial for the person, and it also lowers the BP. So if anyone is having high BP starting stage and they have not started any medication yet, or if there's off and on increase in BP, they should administer that ajwain kadha in their diet. And you can easily mix jeera and ajwain in your diet, and it's very good for diabetes as well as hypertensive or the weight loss thing. Or what you can do, 1 week ratio. 1 week of jeera, 1 week of ajwain. That also works, and it's more like a change. So what we believe in Ayurveda, after 7 days, everything becomes satme. So 7 day change will be good for jeera and ajwain because we take it as a food also. So we need to tell body that this is not food we are taking, it's a medicine. So 7 days, 7 day rotation is very good. And the third drug which I'm going to discuss is asafoetida, or what we call hing. We use it in food daily. And as you all know, it's very good for gas or vat problems. Whenever we have any kind of bath trouble or any food which we think is very vatkarak, we uses hing. But hing has many more other properties. The biggest property is it helps in the reduction of pain. I have done 2-3 single cases I have. The first case was there was a little baby of 3 months, and he was having a severe abdominal pain because he was touching his abdomen again and again. So what we did, we just diluted the hing and put a very small quantity, even I think a pinch of it, that liquid, on his navel. And the child stopped crying within 15 minutes of the applying. A few gas was passed, but the pain was totally gone. Second case I was having, there was a patient who was saying that she's feeling that she will get periods, but her body is like lower body is very heavy and she's not getting any of it, and she was very disturbed with it. So we also applied hing on that her navel area, and the next day she was bleeding. So hing is very, very pungent in nature, no doubt in that. Quantities need to be taken. So the biggest use, why am I telling you, if in case of emergency, if there's someone is having pain or someone is having any that kind of problem, then you can use hing for that purpose. But besides that, hing is very, very good in the management of cancer. It's also a chemoprotective drug. Chronic inflammation, diabetes, type 2 diabetes, heart disease. It is very good antioxidant. Like I told you about giloy, ashwagandha, haridra, that they are antioxidant drugs. So hing is also a very antioxidant drug. But the biggest problem with hing is it is very, very pungent in nature, and its dose does not suit the person. It's generally very warm in nature. So if someone takes it for 3 to 4 days, he starts to complain that, oh, I'm having some kind of urine infection or something like that. So it's not a drug to be taken daily, but it's a very good drug which can be taken in the food. I recommend to use hing in the food or with ghee, because then its pungent nature is little reduced. And it is very good for IBS. If someone is having bloating, constipation, diarrhea, whatever it is, this will go, hing will go. It is also antibacterial, antifungal. It also reduces the blood pressure, very good for cancer, very good for brain health. But again, not to be used continuously. It needs a proper guidance, a doctor's guidance, and definitely not to be given to any pregnant women. So that's the drug which I discussed today. If you have any questions or anything, please feel free to ask.
How much hing would you recommend if somebody's got migraine headaches?
How much? Sorry, how much?
Hing.
Hing. See, hing is pungent in nature. So what I will suggest is this pinch of hing properly fried.
Right.
Okay, it should be fried properly. And then only it can be taken in whole day, not in one dose. Okay, because I don't know your prakriti, your basic, so it's just a vague dose which is safe. So for that, only a pinch, properly roasted, and then taken very little quantities.
Right.
Yeah, how do you take hing for fibromyalgia? See, how I would suggest hing for fibromyalgia is you roast hing and then put a pinch of it in jeera, either jeera or ajwain decoction, and then drink it.
You know, when you said that take 2 glasses of water and a teaspoon of jeera and boil it until it becomes 1 glass. So you take it lukewarm.
You have to boil it and then, when I say decoction, it needs to be taken to the maximum temperature you can tolerate. Like the temperature you take tea or coffee, that's the temperature for the decoction.
Okay. And then you drink it slowly when it's half.
Yeah. No. Slowly. Like tea only.
Yeah. So first thing in the morning?
Yeah, first thing in the morning for, weight loss, cholesterol level, first thing in the morning. See, if you want any medicine to have the maximum result, any herb to have the maximum result, you should either take it empty stomach or just the last thing at night.
Okay.
And when you take the decoction, you should have 1 hour gap between the other thing you do. Anything you eat or drink after that.
Yeah, that's understandable.
Can I ask a question, please? Can I ask a question, please?
Yeah, sure.
You just suggested we can have it at night.
Yeah.
So do you mean at night for cholesterol? Is it okay to take it like tea?
Yeah.
Drink it after sort of 1 hour of meal. Is that what you suggested?
Yeah, but the effect will not be as good as empty stomach. So if someone, like some people, they have a routine. They take some kind of certain thing, like there are people who said that first thing I need to do in the morning is take my tea. So if that is your case, you can do it last at night. But if it is not that case, then you better prefer early morning. But yes, it will work. And it will help in proper digestion of your food, also the food you have taken.
One more thing I wanted to ask. Last week you suggested Hardy or Hardy. I wasn't sure which one you suggested for cholesterol.
Harad.
The other name in Hindi or is or English, typical English name.
Is it Hardy? Hardy.
Yeah, it's Harre. Yes, Harre.
Okay.
Harre.
How do you spell it? H-A-R?
H-A-R-A-D is the name, you can easily get it.
H-A-R-A-D, yeah? Okay, Hardy. Okay, thank you. Thank you.
Yeah, what do you take for constipation when you have a build of saliva in the mouth in the morning? I would prefer jeera.
Jeera, okay. It's just for cholesterol you suggested Hardy as well last week.
No. See, if you're going to go for Harre, then see, the drugs which we are discussed, they are best in their own form. Okay, but if you want to go for Harre, then go for Harre. If you want to go for jeera and harre, that's also okay. But you should be clear and you should be on your, like, you should not switch every, 1 to 2 months. You should continue because all these drugs are antioxidant, and the best results will be seen if we take for a longer period.
Okay, because I want to start with jeera powder. I mean,
Yeah,
jeera water.
jeera decoction. Yeah, that's the easiest. And when you'll take it for 21 days, you'll feel the difference, and then you can decide further.
That will be fantastic. Thank you. I'll come back to you for
Yeah.
that.
Yeah, I have a small cyst of L4, L5, very close to. No, I don't think only taking any kind of decoction or herb can solve it. But for the pain purpose, you need to, you can take the number of drugs which I mentioned. You can take Giloy also. You can take Ajwain also. You can use a pinch of hing also. But the better treatment would be to get it checked or get treated. In Ayurveda, I can tell you the leech therapy, it's very good. So if you get it, any of it in UK, it will be the best.
What kind of jeera do you use? The normal cooking jeera or a black jeera?
No, I prefer normal jeera.
Normal jeera. Thank you.
Yeah.
We have talked about.
Yeah.
I have a question about all the things we use for cooking. So for the children, the family, the food is all like kadhi or rice or whatever you make, or chapatis. You put jeera in it and and also a bit of hing. Is this all okay for children, family? Do they
Yes,
benefit from
yes.
that?
Yes, it's very good for children. It's very good for everyone. See, if we don't use that thing, because right now, a food, the best thing about the Indian food is it is mostly cooked. 95% of the food which we recommend, which is the Indian food actually, that's properly cooked. So that is very essential because that's itself a antimicrobial and free from any kind of, poisoning substances. And when we add such spices, it enhances the medicinal effect of that food also, because each of the food is rich in something.
Yeah.
Even if we take ghee, then there are basic very good properties of ghee. That's why ghee is recommended.
Yeah, and
So
also
it's
in the cooking, to make all these herbs oil soluble, we do use oil. Is that also important that we
Yes.
use the ghee in it?
Yes, the ghee is very important because right now what's happening in India, most of the females, I don't know about UK, so I'm telling about India. So most of the females are quitting ghee for weight loss. That it causes weight gain. So we are not going to. And there's a study going on that osteoarthritis has started at the age of 35. Before it was above 50. And the reason for this is no ghee. Oil, the basic oil we use, it does not have so much of properties, medicinal properties, because it's all,
It's refined.
lab
It's
made.
refined.
Yeah, it's
Yeah, it's
refined.
refined. Yeah.
But for ghee, it has very good properties. First of all, it manages pitta and vata. It's
Yeah.
very good for your skin, for your voice, for your joints, everything. It's very good. I recommend that even if you are, I give it ghee to even my cholesterol patients. I tell them that, okay, you use this decoction, but you take ghee. Because what will happen otherwise, all the constipation, major of the diseases which we feel today, even the fibromyalgia, which is the mostly the question I'm getting now, is because of the dryness of the body. If your body is properly lubricated, then body is all about the joints. If you put oil in the door or any kind of hinge, it will work properly. And if there's no like joints and everything are rusted, they are not taken care properly, then they will pain. So that's same with the.
Yeah, and also when we use haldi, I've noticed when there is ghee in anything, even if I gargle with haldi and I use ghee, I find it more effective. Is it because it's more, the solubility is more in the oil, in the ghee, that it functions better, or is it just something that I thought of?
Yeah, haldi is only soluble in ghee or oil, ma'am. If you
So, okay.
make all the sabzi and then you put haldi in the last, your haldi will not mix. So the
Yes.
basic, the proportion which is told to us from our ancestors, it's
Yes.
all scientific, because haldi is only soluble in oil.
Yes,
That's the
that's
biggest
right.
thing. That's why we recommend haldi water in diabetes to produce the dryness of the body. Because why? Because diabetes is excessive of the lubrication of the body, according to Ayurveda.
Okay. Yes. Yeah. Mhm.
That is not because of ghee or anything, but because of our diet. That
Yeah.
very fatty diet, sitting, routine, sleeping during the day. So that causes the increase of cough. So when we want to reduce the cough, we give the dry things. And haldi, when given with water, is dry. But when haldi needs to be nourished, like when if someone gets, any kind of injury, we give haldi in milk. We don't give haldi water. That's because haldi is mixed in oil, and milk also has the oil content.
Yes, that's right. So it has to be oil soluble. It has to be soluble.
Yeah, yeah,
Yeah.
yeah.
Lovely. Thank you.
Yeah. So one thing I can tell you about fibromyalgia, we are coming with the proper composition for that and the metal. But the first thing which I want to tell you is, you apply oil on your body. You start to apply oil before taking bath. You will find the significant result. Not in a day or two, not in 15 days, but on the 16th day, you will feel that your body is little bit free, less stiff, pain is reduced. Why I'm telling you 15 days or like that? Because our body has 7 layers. So we need to reach oil to every layer of the body. So it takes almost 15 to 21 days to reach whole layers. That also if massaged for 10 to 15 minutes.
Which oil do you recommend for that?
Any medicated oil or the sesame oil is best. I recommend
Sesame.
sesame
Okay.
oil, and you can also make your own oil. Like you can, put garlic, ajwain, this jeera, hing, everything in the oil, and then you make it a little boil till that garlic burns properly, and then you make cool it, and then you store it and use it as long as you want. Then
Okay.
it also has pain relieving properties.
Thank you.
Mriduji, can we use mustard oil?
Yeah, you can use mustard oil, but for some people, it's little bit warm in nature. But if it suits you, mustard oil is also very good.
Yeah. The other thing I was going to ask you is, amla juice, amla. No, herde is for constipation.
Yeah, it's
And
very good for constipation.
yeah, I can't remember the name of that. Anyway, I'll come back to you. Thank you.
Hello? Yeah.
Can you hear me?
Yeah, sure.
Yeah, I'll come back later on.
Hello? Am I audible?
Yes, you are.
Yeah. Please, ma'am, ask your question.
I've asked mine.
Hello? Yeah. Hello? Is there some network issue or something like that?
I think she said she's already asked you the question.
Okay.
And she'll come back to you. I think that's what I heard. Yeah.
Okay. Yeah, the best herb for the constipation is harad. No doubt in that. Because it helps in taking out all the digested and undigested food, which is the quality only found in harad. And it is said that if you take harad, then the first, the first stool which comes out is 3 day old. That's how much stool is stored in our body. Like we feel like we have eaten this and next day we pass the stool, so we are clear. So no, that's not the case. It is said that if you take harad, then the first stool that comes out is 3 days old. So harad is able to process even that.
And what is the function of
Mhm.
herd? Is it an enzyme, or does it activate something in the intestine? What exactly does it do?
It's basically, it has that properties which causes the, activation of the nerves of the, basically the large intestine and small intestine.
Okay, the nerves. Good. Yeah, thank you. Mhm.
Yeah.
And it
It
should be in
increase the,
powder form.
palpitation.
Should it be in
Yeah.
powder form?
Yeah, either the whole harad, if you get it, or the powder form. Yeah, it's best. Harad murabba is also good. Harad
Yeah, but
murabba is also very good. Even,
Mm.
yeah.
what happened to there's been a case in Oldham that there's a gentleman whose wife asked him to take a whole harad, and it ended up in his gullet, ended up with going to hospital, having an operation because it started to expand in his one of the nerves because it went in the wrong tube, and he ended up being hospitalized.
Harad or the powder?
No, she told him to take the whole harad.
No, ma'am. It does not happen. Maybe it's because of coughing or something. There must be some other case. Harad is also like amla.
Yeah, that's what happened. Because I met him, and it happened in Oldham, and this gentleman ended up in hospital because the wife told him to take harad, but she gave him the whole one, and it went in the wrong pipe.
That's because of the persons, sometimes we talk when we eat like that. It's not possible because of harad. It can happen to anything we eat. Sometimes if when we take food, we start coughing because our food gets into the air pipe. We have some kind of thing like that. So it's because of the person, not because of the harad. Yeah, even if he has taken that seed of harad, then also it should not have gone to some other pipe. There must be some other issue, or with the person already which was undiagnosed. Sometimes there's a perforation and we don't know that.
Yeah.
And sometimes we take a thing and it goes, but it is not like for harad only. It can happen to anything. That's the, by chance he took harad.
Yeah.
What's the cause of food getting stuck in esophagus? Very often the first thing is if we talk while eating. The secondly, we take food very fast, not chewing it properly. And the third is food is very dry. Or the fourth one is, we are, I said talking.
Yeah.
We are not involved properly, focused on the food. But mostly it happens if we talk a lot and if the food is dry. That's a major cause. Nose bleeds from right side. What is causing it? See, I can't tell you like that. You have to tell me that what you are taking and why is it happening and since how long it is happening. Because if there must be some reason, because otherwise there should not be any bleeding from any part of the body. Harad is basically a drug. You can easily search on Google, and you can take it in numerous form. You can take it in the form of murabba. You can take it by roasting it. You can take it by making a powder out of it. You can take the decoction of it. That is also very good.
Is it a root? Harad?
No,
Is
no,
it, or is it a fruit?
no, it's a fruit. Fruit.
Okay.
It's a fruit.
Yeah. Okay. Thank you.
It's very good for blood pressure. Again, I say that I've said it last week also. It's very good for blood pressure because harad is a drug which has all the 5 tastes except salt. So the biggest cause of BP, which we say today, is excessive intake of salt. We reduce the salt immediately when we get diagnosed with the BP. So harad is very good for that.
It's part of Trifla, isn't it?
Yeah. It's a part of Trifla. Yeah. If see, there are two things. One thing is I want to take harad only because I want to get benefit from harad only, which is one side. And if I want the benefit of harad, beda, and amla, all the three drugs, then I go for Trifla.
Trifla, yeah.
I tell patient, if you want to take harad and amla both, then better take Trifla. But why I don't suggest Trifla so much is because it's adulterated mostly. When you say harad, there will only be harad powder. When you say amla, it will only be amla powder. When you say behda, it will only be behda powder. So you bring all three powders from market and mix it yourself instead of buying Trifla, because there is some kind of adulteration, because I have seen different taste of Trifla. I had a dilation of esophagus and still food gets stuck. See, ma'am, if you have dilation of esophagus, then your gastric juices must be coming into the esophagus. So that's why your food is getting stuck. So you should think of controlling your digestion. I think jeera will be good for you. And the best thing which I can tell you is do intermittent fasting. What intermittent fasting is? Make at least 12 to 16-hour gap between lunch and the next dinner and the next food in the morning, if you are not diabetic. That will surely help.
That's very easy to do though, because if you eat about 6 o'clock in the evening and then only have kind of water or something, you can survive till morning. Easily.
So what you do, you take dinner at 6. Suppose you get up at 6, you just take some decoction of jeera or anything like that. And then at 9, if you take a tea or coffee, take that. You can take that, and at 11 or 12, you have your food, and then see the difference.
Yeah.
Which herb is best for acid reflux? Ajwain, jeera, harad, giloy, everything works for acid reflux. You can choose as per your convenience. If you have Pitta Prakriti, don't use, Ajwain. But when I say Pitta Prakriti, mostly people mistake it for Vat Pittaj or Kaf Pittaj. Pittaj Prakriti means your predominant dosh is Pitta. So if your predominant dosh is Vat, then it's okay to take.
What's the reason of people getting up and start sneezing in the morning? As soon as they get up.
It's because of allergy. Yeah, it's because of allergy. And the main thing is the pollens around you. That's one thing. And secondly, if your food habits are not good. If you're taking a lot of curd or any kind of thing which is causing congestion in your body, then that's a main reason. The third one is your temperature is not very, optimum. Sometimes it's very high, sometimes it's very low, like that. In your cases, hay fever is very common in European countries because inside temperature is very, tolerable, and outside temperature is very different. So that body gets a temperature difference. So that's how it is caused. That sensory system becomes sensitive. So whenever there's a little pollen, it gets infected by that.
Yeah, that answers it. Thank you.
Yeah.
Mridu, yeah, very good.
Thank you. Thank you, ma'am. It means a lot.
और आप बहुत क्यूट भी है.
Thank you, ma'am.
Thank you very much, Mriduji. I am aware of your time as well, and we have another session in 10 minutes. So
Yeah, sure.
I wish you all the very best for the weekend, and we shall catch up
Thank
next
you.
Saturday. And if
Thank you.
anybody
Thank you very much.
has, you're welcome. And if anybody has any more questions, put it in this
Thank
group, and Mriduji will try and answer you. Thank you all. Have a lovely weekend. Don't forget,
you.
we
Thank
have.
you.
Thank
It
you.
was a
Um,
lovely
Thank
you're
session.
you,
welcome.
Panaji, Nehaji,
You're welcome.
Madhuji.
Thank you.
Appreciate all that.
Yeah,
Thank you,
thank